on breast implants, and we know that there's been a scandal that has broken out on hip implants. But we're being told that there shouldn't be authorization for marketing of these products. But if we'd had stricter authorization systems, we wouldn't have had these scandals broken out that have erupted. And then finally, on clinical trials, the European Medicines Agency is being attacked by a medical lobby called AbbVie, which produces an inflammatory drug, because of the clinical trials being held. And I'd just like to say, Commissioner, that we should have a note in the regulation that there should be access called for clinical trials. And if we put that in the regulation, then the pharmaceutical laboratories will no longer try to sue the European Medicines Agency because of over-transparency issues. Thank you.
Thank you, Chair. I have a quick question. No doubt the Commissioner may be aware that last week a legal challenge to the Scottish Government's bill on minimum unit pricing for alcohol had failed. The minimum unit pricing is designed to tackle problem drinking and the negative health effects that brings. So I'll be interested to hear the Commissioner's view on the outcome of that legal case and on minimum unit pricing. Thank you.
Vielen Dank. Vorbildlich, was die Zeit angeht. Gilles Pagnot, s'il vous plaît.
Yes, very briefly. First of all, I just want to say that, as was recalled by the chairman just now, yesterday evening we got an agreement in the trilogue with the Commission and the Irish Presidency and Parliament regarding cross-border health threats, and we would like this decision now to be discussed and adopted at the plenary in June, because we think there is really an urgency issue here, particularly when you look at what's happening with the H7N9 virus in China, and this is of great concern with the WHO and indeed with the European Commission services. And I'd like to welcome the fact that at the trilogue the Commission played a very useful role. DG Sanko played a great role there at the trilogue, trying to facilitate the agreement. Now, this virus, well, on the subject of this virus, I'd like to hear from you. What's happening at the level of the European Commission? What's the status quo? What's the situation? How are things developing? We know that there could be human-to-human transmissibility of this virus. We've already seen that 25% of cases that have been detected have led to death after just 2 days of the detection of the virus being transmitted. And we know that there is a mutation underway as well. Second question, bisphenol A. We asked for a study to be carried out by EFSA, and there's been a delay in terms of the diagnosis, but we know that in France there have been 200 collaborators working together on this, talking about the carcinogenic impacts of this particular substance. So I'd like to have your views on that. Thank you.
Merci, Monsieur le Président.
Mrs. Oconi, please. Yes, thank you very much indeed, Commissioner. Dear colleagues, Commissioner, thank you very much for being here with us for this structured dialogue today. I have 2 questions for you very quickly. First of all, I think the first question has already been touched on, but it concerns cloned meat. At the moment, we are working on a report which talks about regulation for electronic bovine identification, and obviously cloned meat is a very important issue within that context. You talked about the fact that there was a legislative proposal that would be unveiled in June 2013. You said this on the 13th of November 2012, so I'd like to know what the news is on that front. I think you've already touched on this briefly, but I was at another meeting, so I didn't hear what you said. Secondly, on the 6th of May, at the launch of the legislative package, you said that we were waiting for an impact assessment looking at meat, or bovine meat and goat meat, and this is about processed meat in particular. So I'd like to know what the results of that study have been. It's important to have this information because you did say that you would give us the results of the impact assessment before the end of the year. That was the idea at the beginning. So what's the situation? When are we going to get the presentation of this assessment? I'm working on the bovine electronic identification legislation, so I'm just wondering if we couldn't take this opportunity to introduce an amendment in this regulation on this particular subject. Thank you. Mrs. Bellier, please.
Merci, Monsieur.
Thank you very much, Chairman, and thank you to you, Commissioner, for being here with us this morning. On seeds, we will indeed be able to come back to this subject once we've looked at your proposal in detail and more thoroughly. But today I just wanted to thank you, first of all, and thank your services in DG Sanko for the work that has been done and the results that have been achieved on the suspension of these 3 neonicotinoid insecticides. And we know that it was a tough job for you to achieve this. We know that it was tough in Parliament as well. But really today I'd just like to look at the issue of assessments and talk about 2 particular questions when it comes to bees and pesticides. First of all, we have now suspended, with your help, the 3 neonicotinoids, but there's a new neonicotinoid that has been authorized in the meantime, sulfosaflor. So I'd just like to know what the timelines are. When are you going to carry out EFSA assessments on these other neonicotinoid products and products belonging to this toxic family of substances? And then, secondly, when it comes to the modification of the honey directive and the analysis of that work, I'd like to know why the Commission hasn't actually presented the impact assessment on this yet. I'd like to know if the Commission intends to do so, and if so, when.
Masej Kukovic.
Thank you, President and Commissioner. Food health and economic growth are interconnected issues. That's why I began, together with Slovenian institutes and with Initiative Poželjna Europa, I began a project, Food for Health and Workplaces. We, based on the results, the purpose of the project was to encourage local and healthy food, and to encourage and utilize 4 key types of crops: legumes, garlic, berries, and buckwheat. They are almost forgotten and now are largely imported. And I have 2 questions, Commissioner. First, health greatly depends on food. Has the Commission performed specific studies in this field? And if so, what are the key issues? And the second, has the impact to health been assessed also for those 4 types of crops: legumes, garlic, berries, and buckwheat? About the seeds, thank you. You gave us the response. Thanks.
Thank you very much. Edith Estrella.
Presidente, a senhora pergunta é sobre o agravamento das...
Thank you very much, Mr. Chairman. Can I just raise a question on the health imbalances between different countries, particularly as between the programme countries and the rest? The Commission had a communication on solidarity in the area of health, and I was the rapporteur for this dossier. And there was to be an interim report on progress made in this field in 2012. However, that has not been published, at least not so far. Now, considering the fact that we are receiving news that the situation in many member states has become much worse, Portugal, Greece, and in Spain as well, I'd like simply to repeat this question. Commissioner, are you aware of this worsening of the imbalances in health between the programme countries and the rest? And are we going to continue to see the impact of austerity policies in the area of health? Are you aware of the impact, the health impact, which the austerity packages are having?
Sehr geehrter Herr Kommissar, Herr Vorsitzender, ich möchte dem Kommissar mal...
Mrs. Kadenbach. Thank you very much, Chairman. Thank you, Commissioner, for your determination and staying power when it comes to neonicotinoids. Can I say that, just to pick up one point made by Karl-Heinz Florenz, this is one of the areas where there are many question marks. It's not just the pesticides either. It's also got to do with biodiversity. And with the draft which we've seen on seed, I think that we're not perhaps quite as enthusiastic as you are. We think that there may be things there which are having a negative impact on biodiversity. And you can imagine that we're going to be submitting a number of amendments to get the balance improved. Biodiversity and pollinating insects. There is a link there with seed as well. I think now the scientific evidence is stacking up, suggesting that GMOs are having an impact, and that pollinating insects involved in pollination, are being affected. And I think that has to be evidence on one side of whether we should be pushing ahead in the area of GMOs in our various member states. I'd like to echo what was said by Mrs. Roth-Behrendt as well. When it comes to labelling, I think again that's something with cloning. I think that this is one of those areas where we are really speaking up loud and clear on behalf of people outside, as in the case of biodiversity. Thank you very much. This brings us to the end of that list of the second round of questions from the floor. And, Commissioner, I'd like to give you this an opportunity to respond to all of those questions in what time we have left. Thank you.
Thank you, Mr. Chairman. I'll try to group the questions together. On place of origin labelling, I have told this committee, when we had the horse meat scandal debate, that I have an open mind on this issue, which does not mean that we will not face problems on this issue. I am still waiting for the impact assessment report, which was due by the end of this year. We are trying, and I think we'll succeed, on getting the report by the end of the summer, beginning of autumn, and then, depending on the results of this report, we shall propose, we'll make our proposals, which does not mean that we won't face a bumpy ride in several areas, internally, but also externally. Although I must say that there is a growing number of member states and a growing number of parliamentarians as well who are lobbying in favour of this proposal, and there is a growing number of member states in the Council who want this place of origin labelling. Of course, then we have to decide what place of origin means, where the animal was born, or where the animal was slaughtered, or where the animal was bred, and what the cost, because there will be a cost for this labelling. And I appreciate what you said, that was most of you who raised the subject said that this is, technically speaking, unrelated to the horse meat scandal, but the horse meat scandal spurred the lobbying in favour of more transparency in information to the consumers. And we must also see what type of labelling will be made as regards place of origin labelling for the unprocessed products, which is a matter which is being discussed by the Agricultural Commissioner, because I think you would agree with me that the type of labelling, if the impact assessment indicates that this is possible, should be harmonized with the labelling on the unprocessed meat. Otherwise, if we have more stringent labelling for the processed food than for the unprocessed one, I think would have some confusion legally speaking. But I have an open mind on this question. Particularly the more member states are in favour of introducing this labelling, of course we'll go ahead with the proposal, which is why we stuck to the time frames. Indeed, we are going to deliver before, and I don't think this should have been introduced in the animal health package, but as required by this Parliament, will abide by the timeframes, that is to say, the report by early autumn instead of the end of this year. By the end of 2014, we'll have also the report on the extension of place of origin labelling to other kinds of unprocessed meat products, which would include poultry, goats, sheep, etc. So I can give you my commitment in this regard, depending always, however, on the difficulties which one can face, even internally, in proposing this kind of legislation, which will certainly have an administrative burden, but that could be a fair or unfair price, depending on which view you take, in order to give more information to the consumers. I appreciate Mr. Florence's comments on bees and mice. Probably protecting mice would be slightly more difficult than protecting bees, because bees seem to be more popular than mice, which does not mean, however, that mice do not have also a role to play, even as regards our agriculture. But you mentioned the tobacco directive and the tobacco lobby and the lobby of tobacco industry. And I'm going to mention something which I mentioned at the beginning of my address. Those who are against what we are proposing in this tobacco directive, and even more against what you are proposing as amendments, because you are trying to be even stricter than what the Commission is proposing, those who are opposed will not say no. They will try to postpone, to procrastinate. And there are already attempts in this regard. For instance, which council should discuss this directive? The Health Ministers' Council, the EPSO, or should it be discussed also in the Competitiveness Council? And we already had a first general debate in the Competitiveness Council, where the attitude, of course, of the competition ministers was different from that of the health ministers. This is predominantly a health issue. As I said, of course, if we succeed in reducing the number of smokers by 2%, which means 2.4 million smokers less, this will have economic consequences. Some of them will be negative, but others will be positive. And then what should the EU Health Commissioner do? Promote smoking in order to create more jobs, or protect the health of EU citizens? And I think this is a rhetoric question. As is to say, the answer is in the question itself. So a word of caution is, let's try to prevent anyone from using intelligent ways in order not to say no, but not to say anything, with the hope that this legislation will not pass during the current parliamentary mandate, which means a new parliament will have to appoint new rapporteurs, we will lose another 3 years, even this directive, even if everything goes fine with this directive, it will not come into effect before 3.5 years' time, 4 years' time. If we lose this opportunity to pass it during the current parliamentary mandate, then everything will be postponed by a further 3 years. It will be in 7 years' time, if at all. So let's be careful about this question. On the seeds, Ms. Kadamar, I tried to spell out the facts. And this literature which is being passed to commissioners, to parliamentarians, is inaccurate on the facts. Of course, we can always fine-tune the legislation. We can always do something to allay the fears of those who think that we are trying to do something to strangle something which is traditional, which is never in the Commission's mind. On the contrary, the measures are liberalizing a sector which is today is much more regulated as regards traditional seeds and as regards niche seeds. But I'd be very happy to consider any amendments when it comes to the approval by the co-legislators as regards this issue, because it is never the intention. I have, I think, listed the facts why this is not true, but if I have missed something, please inform me, because it is not the intention of the Commission in any way to strangle traditional seeds. And now we have even some politicians who are saying, now because we did pressure on the Commission, they have changed their position. This is not true. The position in the legislative proposal was always the same. Food and relationship to health, of course, it is one of the factors relating to chronic disease. We usually say the risk factors are 4: lack of physical activity, nutrition, and tobacco consumption and alcohol consumption. And if I can link to alcohol, and I was asked on the minimum pricing on alcohol. All the studies which I'm informed of regarding measures to control either tobacco or alcohol have shown that, contrary to popular belief, the measures which are most effective are the fiscal ones. We might think that it is the education campaign against smoking or against alcohol which is the most effective. But I was surprised to learn that it is the fiscal measures which are the most effective. So it is not true to say that if the price of alcohol is increased or the price of tobacco products is increased, then those who smoke will still smoke or smoke to the extent that they used to smoke before. It does have an effect. You could call it a cruel measure or a callous measure, but it does have effect. And this applies also to food. The more prices are raised as regards unhealthy food, the consumption will decrease. So I'm very happy to learn that the litigation regarding the minimum prices has failed, in the sense that it has been won by the authorities. As I have said publicly as well, in principle we are in favour of this approach, anything which reduces alcohol consumption and which is in line, of course, with the European treaties themselves. Imbalances. I remember during my hearing I said, I'd love to have a cohesion policy not only for economic reasons but also for health reasons. And there are divergences. If you just look at the life expectancy of European citizens, it varies from one country to the other. Now, I told health ministers it is useless to whine about budget cuts. They will come. They have already arrived. They've hit the Commission as well. And even Sanko has to face a budget cut. So rather than saying no, 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 and then the budget cuts will take place just the same, it would be much better to try and influence decisions relating to the budget cuts, not because the health budgets of the member states will be immune from the budget cuts, but that the cuts will be done in such a way that we can spend less but still retain certain minimum standards of health care. Now, if you were to ask me, have the budget cuts influenced health care? Well, it's very difficult to gauge immediately what has happened, because certain conditions like the mental health question in certain states could be a result not of the budget cuts but of the economic crisis itself. But we are monitoring the situation. I can assure Ms. Estrela that we have not lost our social compass, at least in the Commission, in the Sanko, we have not lost that social compass, and that will be monitoring the situation in this respect. Indeed, as I said during my visit to Greece, we are here to help, not to impose austerity measures, but in order to have sustainable health systems, all countries, whether under supervision or not, will have to introduce certain reforms. But the positive side is that there are means of modern technology which can help us in spending less, but at the same time guarantee certain minimum standards of care. For instance, next week I'll be visiting Northern Ireland to also see the e-health system, how it has been applied in Northern Ireland, saving costs. They have a very successful system of e-health. 20,000 patients participate in this scheme, and this is not even a country, it's a region in a country which has done wonders with this system. Mr. Parniot mentioned the cross-border health risks. First of all, thank you very much for for your appreciation of Sanko's work in this respect. I was worried before this health threat, cross-border health threat directive was approved by the co-legislators, because the principle of subsidiarity is a very convenient argument, either usually to prevent the Commission or Parliament from involving itself in any activity. Don't touch this because this is a matter for member states. And on health issues, the principle of subsidiarity is even stronger than in other issues, which might explain why in 12 months the health ministers, the EU health ministers, unlike the agriculture ministers and the foreign ministers, meet only twice a year. I'm trying to persuade the presidency to at least have 3 meetings a year rather than 2, because with all this legislation, medical devices, tobacco directive, clinical trials, how do we expect the health ministers to decide on all these issues, and not only legislation but also measures, when there are only 2 meetings a year of health ministers? But I remember telling the health ministers, the principle of subsidiarity has another side, not just one. We usually quote only the first one, that do not interfere with member states. But the proviso is, in those matters which can be efficiently carried out by the member states, in those other matters like the avian flu threat or other cross-border epidemic threats, where we can fight this threat united rather than separately, the principle of subsidiarity itself requires us to coordinate better. And that's why I'm very happy that with your help and with our assistance, this cross-border health issue has been now solved to the satisfaction of all. What are we doing about the H7N9? Till now, the World Health Organization, as on the 2nd of May, reported 128 confirmed cases of human infection, and 26 patients, as you said, have died. Now, the Commission is monitoring this situation on a daily basis. It's in close contact with WHO and with the Stockholm and with the European Centre for Disease Prevention and Control in Stockholm. And this is a perfect example of the need of a coordinated response. And since the 31st of March, the European Centre has prepared 2 risk assessments, which were shared with the member states, and a 3rd assessment is due soon. The source of the virus has not been confirmed so far, and so far there is no evidence of sustained human-to-human transmission, although the mutation which you mentioned, of course, in the future cannot be excluded. And more than 2,000 close contacts of influenza cases have been investigated, and in this investigation of 2,000 cases, no evidence of person-to-person transmission has been found. So the risk of spreading of this disease spreading to Europe till now is considered low. However, any person who has been to China and presents severe respiratory infection in the EU is being investigated in Europe, and for this reason we have had an interim case definition of influenza H7N9, which has been agreed with all the member states. And as you know, we have also the EU Health Security Committee and also the EU Early Warning and Response Team. And this network will take place tomorrow as well. There's another meeting tomorrow of this network. And we are also having a mechanism to support sample sharing, which has been activated to support those member states who wish to send samples to the WHO reference influenza laboratory in the UK in order to characterize the virus. So even though the risk is low, it is on the horizon. So we are, I also visited recently our Luxembourg unit to see what is being done in respect of these diseases before the outbreak of this disease. I was impressed by what I saw, but let's us never be complacent on this issue. In the meantime, all live poultry from China is prohibited from entry inside the European Union. I think those were, at least if not all, most of the questions which were mentioned to me on aspartame. Sorry. On aspartame, we have the opinion from EFSA, which should be ready towards autumn of this year, and the reason which EFSA told me that they have not yet issued this opinion is because of the high number of comments which EFSA has asked, which has received, and therefore EFSA itself has asked for more time, and we have accepted this, this extension. On bisphenol A, like as any other substance, an EU measure is always a better option, and national bans are not helpful in an internal market. And we are awaiting the EFSA evaluation on this issue and also the French measure. On Scottish alcohol, I have replied. On endocrine disruptors, here Commissioner Potocznik is in the lead, but we are cooperating with his DG and also participating in the process because of the impact on cosmetics, pesticides, etc. And indeed, we should come out with the criteria on endocrine disruptors by the end of the current year.
Ja, vielen Dank.
Thank you very much, Commissioner. I think that we could have a dialogue at every single Environment Committee meetings because there are so many issues that we must deal with and still coming our way. And I would also like to thank my colleagues for this debate and thank you for answering our questions. And we'll have a great deal to work on up to the end of our mandate, but I hope that responsibilities in the Commission will become clearer, because some of colleagues have said that the health aspect of food safety aspects are one and the same